Okay, could you just start by telling us your name and what your role is here at the health department?
My name is Malaika Gallimore, and I am a communicable disease and a TB control nurse.
Okay. So this year there's been or I guess since the end of last year, there's been a mumps outbreak here in Columbia. Can you tell me when that outbreak began and kind of its origin?
Well, yes, I can. We have the start of the outbreak as August 22nd of 2016. And I'm not sure if you guys know this, but 2015 in the summer, there was a mini outbreak of mumps on campus. So we've been kind of surveilling and getting reports here and there about mumps. So in August, we had like a case, and we were like, well, it's just one. Then we got a couple more, and then it seemed to kind of really explode after homecoming. So that's kind of how it started.
Okay. And then how many are currently infected, or how many are you monitoring?
We have, I couldn't tell you that.
Okay.
Because they don't, they're not admitted in the hospital, so the symptoms last like a week. So we probably have like 10 people who are actively sick right now.
Okay.
But
do you have a number of how many cases there have been since August?
Since August, and our last numbers were updated on February 7th. We have a total of 370 cases. 334 of those are MU students.
Oh, wow. Okay. So what is the general process of investigating an infectious disease like mumps?
With mumps, right now, student health has been an amazing partner throughout this whole outbreak. So it's made it a lot easier to deal with this amount of cases that we have. So we usually, if they're student health, we have a mumps questionnaire that we developed. So it has just general demographics and asks about swelling in the parotid gland, left or right, when did it start, onset date, what other symptoms they have, and then contacts, friends, boyfriend, girlfriend, where do they work, where do they do recreational things, have they traveled anywhere, and then their MMR dates.
Okay.
And with mumps, it's just kind of supportive care, so ibuprofen, plenty of fluids. There's not much to do with like the treatment of mumps.
Right, because it's a virus.
Yeah. If it was something like pertussis, then we would be making sure that everyone was on prophylactic antibiotics. But with mumps on the treatment end, it's pretty easy. It's just the amount of interviewing in cases that we have.
So you kind of touched on this, but one of the challenges of mumps is that it is a virus, so you can't really treat it prophylactically. What precautions do you or would you suggest to patients and people who are not infected to control the disease and kind of break the chain of infection?
So the really difficult thing also with mumps is that the incubation period is 12 to 26 days. It's super long. And then people are infectious a few days before they have symptoms. So they're exposing all these people and making them sick before they even know they're sick. And then it takes the next person another 14, 20 days before they have symptoms, but 3 days before that, they're sick too, and that's what's basically happened. So the main thing is like not sharing any utensils or drinking after people. Stop kissing people. Stop hooking up after going to the bars. That because it's really spread through saliva, and you don't have a lot of coughing or snotting or anything like that with mumps. So it's really stop sharing lip gloss and chapstick, especially because the person doesn't look sick, so you don't know that they have mumps. They don't know they have mumps, and that's a theory we have is all of the pumping that happened right before homecoming probably spread a lot of mumps because they use the tissue paper and lick it and dip it in glue and then put it on the house deck. 1,000 or a million times.
Yeah, it's disgusting. I had to
Yes.
do that.
Yeah. So right after a homecoming, 2 weeks later, we saw this huge spike, and I'm sure that probably helped. We've heard reports of ice luges with like you pour shots down. It's another great way to spread mumps. So it's very hard to tell people who are having fun to stop having fun.
Sure.
But that would really help. We're hoping that the Christmas break, when everyone was away from each other for one incubation period, that'll help slow it down.
All right. And what's the role? You talked a little bit about partnering with student health. What's the role of the health department in the outbreak, or in even just tracking it?
So student health is, if we didn't have student health, we would have to interview every single case. But they do a lot of the interviewing for us at point of care. And then we do the reporting back to the state. We need to report all of our confirmed cases, probable cases, suspect cases. And at the end of the outbreak, we'll write a report to the state. And then communication. We do a lot of communication with the community. We have this information up on our website. Letters have gone out to providers in the area. And then we also do some testing for people who don't go to student health or MU urgent care. So we'll get people from Providence urgent care. They'll send people over here and we'll test them, draw blood and do a swab. And we can send all of our specimens to the Missouri State Public Health Lab. Yes, that's what we do.
Yeah.
And then determining that everyone that's got 2 MMRs at least is another part of that.
And so through the midst of this outbreak, you've compiled a lot of data on this particular community. How does it relate to other outbreaks around the country? Because I know in 2016 there were quite a few.
Yes. There are quite a few. It's just a typical mumps outbreak that ours is so far small. In Illinois, they had one, and it went like a year and a half, and they kept getting a whole bunch of cases over the summer. So we haven't gotten that long into it. And Iowa had an outbreak too that lasted like a year and a half, 2 years. So we're not there yet, but we're still seeing cases. I mean, every day we still get a report. So I can tell you definitively because it's still happening.
Right.
Right now, everything seems pretty normal. It's what people all across the United States and Europe. It's the typical mumps outbreak.
Okay. So our next couple questions are about vaccines and the MMRs. What's your take on mandated vaccines or vaccinations, especially related to mumps?
Me personally, Malaika Gallimore is 100% for mandated vaccines. With the MMR, the mumps component is 88% effective. So in a completely 100% vaccinated population, 12 people out of 100 could still possibly get mumps, even if everyone's vaccinated. I'm not sure if our numbers are in line with that, but I guess absolutely everyone should get vaccinated, all the vaccinations, all of the time.
And then our last question is another kind of one for your opinion, but one that we thought was interesting. Do you think that the prevalence of the anti-vax movement, has that contributed to this outbreak and recent outbreaks?
Not with mumps, I don't think so. With our outbreak, every single person has been fully vaccinated with 2 MMRs. So nothing much you can do more than that.
That's right.
So with mumps, no, I don't. It's because it's the weaker of the component, I think, and also we had a conference call with some CDC scientists on the MMR team, and they talked about the intensity of exposure that is on a college campus. So if I got exposed for mumps by one person in the grocery store, it's just that one time. But when it's circulating on campus, you could get exposed many, many times and maybe overwhelm that vaccine protection.
Mm.
So that's kind of interesting.
Yeah.
But you should still get all your vaccines.
Okay. Yeah, well, thank you very much for answering these questions. We'll let you know how our project goes, and
Okay.
we really appreciate you taking the time.
Sure.
Yeah.